How to change a Flocare gastrostomy tube. This short video will explain how to replace the Flocare gastrostomy tube as part of your routine patient care. Best practice recommends the patient is nil by mouth and tube for at least 2 hours, if tolerated, before a tube is replaced. This allows an accurate pH level to be obtained, confirming position and reducing the risk of aspiration. This video is provided as guidance only and follows procedures as per Nutricia Homewood Nursing Service policies, which were current practice on the date of filming. The information, opinions, and recommendations in this video are not intended to replace the expertise of a healthcare professional. Please be aware this is not the procedure for emergency situations. Before commencing the tube replacement, you should consider other factors that could potentially present a risk. Is the patient taking medication that influences gastric acid pH? Are they receiving time-critical medication? Blood clotting disorders, recent surgery, and new medical conditions or treatments should also be taken into consideration. Wash your hands before preparing the equipment. Checking gastric pH. Before changing the tube, it is best practice to measure gastric pH to ensure it's safe to proceed. You will need a 60 ml enteral syringe, pH indicator strips. To check that the pH indicator strips are CE marked for human gastric aspirate and are in date. First, close the clamp and open the end cap of the tube. Then, attach the enteral syringe to the feeding tube. Open the clamp and slowly pull back on the syringe plunger until at least 1 ml of fluid appears in the syringe. If the fluid resembles enteral nutrition, you should discard it and re-aspirate. If you are unable to obtain gastric aspirate, ask the patient to lie on their left side for 15 minutes, or try giving mouth care to stimulate gastric secretions. If it's still not possible, do not replace the tube and contact your managing healthcare professional for advice. When you have at least 1 ml of fluid, close the clamp, detach the syringe, and replace the end cap of the tube. Drop the fluid onto a pH indicator strip and follow the manufacturer's guidance. A pH value of 1 to 5.5 suggests the tube is in the correct position in the stomach. If you see a pH value of more than 5.5, do not go ahead with the tube replacement and contact your managing healthcare professional for advice. Preparing to replace the tube. To prepare the equipment, you will need a new tube of the correct size for your patient. To check the tube is in date, lubrication, 2 times syringes for deflating and inflating the balloon, 60 ml syringe for aspiration and flushing, sterile water, cleaning agent, gauze, and PPE as per local policy. Then pre-fill a syringe with the volume of water recommended by the manufacturer's instructions. Double-check that the tube is the correct size. And check the new tube for irregularities. Move the retention disc away from the balloon. Then check for symmetry in the balloon by inflating it with the appropriate volume of water. And then deflating it again. Ensure the balloon is empty of water. Move the retention disc out of the way and note the centimeter marking on the tube closest to the skin level. Clean the stoma site and apply lubricating gel to the stoma tract. And rotate the tube to confirm it moves freely. If it doesn't move freely, do not go ahead with the tube replacement and contact your managing healthcare professional for advice. removing and inserting the tube. Ideally, the patient should be in a semi-recumbent position. Attach an empty syringe to the balloon inflation port of the tube, far enough to open the one-way valve. Gently pull back on the syringe plunger and withdraw fluid until no more water comes out of the internal balloon. The balloon should be completely empty. When the balloon is fully deflated, slowly remove the old tube from the stoma site. If there is any resistance, stop and contact the managing healthcare professional. Before inserting the new tube, ensure the tip is lubricated. Now insert the new tube a couple of centimeters further than the centimeter marking notes previously. When the tube is fully inserted, connect the pre-filled syringe and inflate the balloon with the sterile water. Gently pull back until resistance is felt, and confirm the centimeter marking at skin level is the same as noted previously. Move the external retention disc until it's 2 to 5 mm from the skin level. Checking the position. Follow the same steps as you did to check the pH value at the beginning of this video. Check the clamp is closed before removing the end cap. Attach the 60 ml enteral syringe and open the clamp. Very slowly pull back on the syringe plunger until greater than 1 ml of fluid appears. Close the clamp, detach the syringe, and replace the end cap. Drop the fluid onto a pH indicator strip. A pH value of 1 to 5.5 suggests the tube is in the correct position. Flushing the tube. The patient should be positioned at an angle of at least 30 to 45 degrees. Flush the tube with water, type and volume as recommended by your managing healthcare professional. The patient needs to remain in this position for an hour to prevent aspiration. Ensure you carefully close the end cap. Monitoring for signs or symptoms. Any of the following signs observed within 72 hours of a tube replacement should be treated as an emergency. Pain or distress after the procedure. Pain during feeding, including medication delivery and water flushes. New bleeding from the stoma site. Fluid leaking around the tube. Stop feeding or delivering medication immediately. The patient requires urgent medical attention and needs to be taken to a hospital. Always ensure you follow your managing healthcare professional's instructions.